Welcome to our program on understanding and managing anemia. Anemia is a common condition that affects millions of people worldwide. Today, we'll explore what anemia is, its causes, symptoms, and how you can manage and prevent it. Anemia occurs when your blood doesn't have enough healthy red blood cells or hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen to your body's tissues. Without sufficient oxygen, your body can't function properly. According to the World Health Organization, anemia affects about 1.62 billion people globally, which is roughly 24.8% of the population. It is particularly prevalent among children and pregnant women. In children, anemia can lead to developmental delays and behavioral disturbances. For pregnant women, it increases the risk of complications such as preterm delivery and low birth weight. There are several types of anemia, each with its own cause. The most common type is iron deficiency anemia, which occurs when your body doesn't have enough iron to produce hemoglobin. Iron deficiency anemia can often be managed with dietary changes and supplements. Foods rich in iron include red meat, beans, lentils, and leafy green vegetables like spinach. Other types of anemia include vitamin B12 deficiency anemia, folic acid deficiency anemia, and anemia of chronic disease. Each type requires a different approach to treatment and management. Symptoms of anemia can vary depending on the type and severity. Common symptoms include fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness, and cold hands and feet. If you experience any of these symptoms, it's important to see a healthcare provider for a proper diagnosis. Anemia can be diagnosed with a simple blood test that measures your hemoglobin levels and red blood cell count. Once diagnosed, the treatment for anemia will depend on its cause. For example, iron deficiency anemia is typically treated with iron supplements and dietary changes, while vitamin B12 deficiency anemia may require B12 injections or supplements. Managing anemia often involves a combination of medical treatment and lifestyle changes. Eating a balanced diet, taking prescribed supplements, and addressing any underlying health conditions are key steps in managing anemia effectively. Preventing anemia is also crucial, especially for those at higher risk. This includes pregnant women, young children, and individuals with chronic illnesses. Regular checkups and blood tests can help catch anemia early and prevent complications. Personal stories can also shed light on the impact of anemia. Meet Sarah, a young mother who struggled with iron deficiency anemia during her pregnancy. She shares her journey of diagnosis, treatment, and recovery. I was constantly tired and couldn't keep up with my daily activities. After my diagnosis, I started taking iron supplements and made changes to my diet. It made a huge difference in my energy levels and overall well-being, says Sarah. Experts also emphasize the importance of awareness and education in combating anemia. Dr. John Smith, a hematologist, explains the need for early detection and proper management. Anemia is often overlooked, but it can have serious consequences if left untreated. Regular screenings and a proactive approach to health can make a significant difference, says Dr. Smith. In conclusion, understanding anemia is the first step towards managing and preventing it. By recognizing the symptoms, seeking medical advice, and making necessary lifestyle changes, you can effectively combat this condition. Stay tuned as we delve deeper into the different types of anemia, their specific causes, and detailed management strategies in the upcoming chapters. Thank you for joining us on this journey to better health. This concludes our introduction to anemia. We hope you found this information helpful and informative. Remember, knowledge is power when it comes to your health. Anemia is a condition in which your blood doesn't have enough healthy red blood cells. Red blood cells are crucial as they carry oxygen to your body's tissues. Without sufficient oxygen, you may feel tired and weak. Anemia can be caused by several factors, including iron deficiency. The most common cause, often due to blood loss, poor diet, or an inability to absorb enough iron. Vitamin deficiency, lack of folate or vitamin B12 can lead to decreased red blood cell production. Chronic diseases. Conditions like cancer, kidney disease, and autoimmune disorders can interfere with red blood cell production. Genetic disorders. Conditions such as sickle cell anemia and thalassemia are inherited and affect hemoglobin production. Other factors: blood loss from surgery or injury, bone marrow diseases, and infections. The symptoms of anemia can vary depending on the cause and severity, but often include fatigue and weakness, pale or yellowish skin, shortness of breath, dizziness or lightheadedness, chest pain or irregular heartbeats, cold hands and feet, headaches. Diagnosing anemia typically involves physical examination, checking for signs like pallor and rapid heart rate, blood tests, including complete blood count or CBC to measure red blood cells, hemoglobin, and hematocrit levels. Additional tests, depending on the suspected cause, such as tests for vitamin levels, iron levels, and bone marrow biopsy. Treatment for anemia depends on its cause. Iron deficiency, anemia. Iron supplements and dietary changes to include iron-rich foods like red meat, beans, and leafy green vegetables. Vitamin deficiency anemia. Supplements and dietary adjustments to include more vitamin B12 and folate, chronic disease anemia. Treating the underlying disease and possibly taking medications to stimulate red blood cell production. Genetic disorders. Treatments can include blood transfusions, bone marrow transplants, or medications to manage symptoms. Blood loss, anemia. Addressing the source of bleeding through surgery or other interventions. Preventing anemia involves balanced diet. Ensure your diet includes sufficient iron, vitamin B12, and folate. Foods like lean meats, fish, beans, nuts, and leafy greens are excellent choices. Regular checkups. Regular health checkups can help detect anemia early, especially if you have a chronic condition or are at risk. Supplements. If you're at risk for anemia, your doctor may recommend iron or vitamin supplements. Avoid excessive blood loss. Be mindful of injuries and manage menstrual bleeding if it's heavy. Healthy lifestyle. Regular exercise, adequate sleep, and stress management can support overall health and well-being. Anemia is a manageable condition with the right approach to treatment and prevention. If you suspect you have anemia, consult your healthcare provider for proper diagnosis and treatment. Stay healthy, and thank you for watching.